with back pain from a car accident, a sports injury, or just from picking something up the wrong way, you know it can affect your whole life. Sleepless nights and your time standing is limited. My next guest says he can bring you relief without surgery or medication in many cases. Please welcome chiropractor Dr. Cress Williams with New Life Source Chiropractic. We're also joined by two of his patients, Emily and Lynn. Good morning. All right, Dr. Williams, in a second, I'm going to get you to explain the power of chiropractic medicine, because we have been, I think, so trained to think that it's medication and surgeries that get us where we need to be. And your belief is that the body can help heal itself if you give it a chance. Okay. Emily, what happened with you?
Well, about 14 years ago, I was in a diving accident and broke my neck at the C5, C6 level, leaving me paralyzed from the chest down. And lately, I think wear and tear. I've had a whole lot of pain in my neck and my shoulders, and just from doing my everyday stuff that I have to do. And my aunt actually suggested, my Aunt Amy, who's been on your show before, suggested that I go see Dr. Williams.
Now, what had you tried before to try and deal with that pain?
Just a lot of conditioning, exercise. I don't take a lot of medicine, so yeah, I had over-the-counter stuff and, you know, ice, stuff like that. But really, that's why I went there. And you know, I couldn't really move my neck all that much because it was just getting so tense. And he almost immediately, that was relieved. I started moving. I could move my neck far. And
so, Dr. Cress, what was going on inside of her? Because the key is, instead of medicating the symptom, is to find out what the cause is and try to eliminate that. What was going on?
Well, in her case, when she broke her spine, this is a side view of the spine, you have 7 vertebrae in your neck. 4 of them were screwed together with titanium screws. Thanks. So when that happens, obviously the whole spine is going to be affected. Then when you're sitting in the chair and you're using your arm so much, it puts a tremendous strain on this upper cervical area. So that pressure was causing all that pain and discomfort. So we started to mobilize that with some of the devices we have, and she started to feel better, which I thought was very encouraging. But go ahead and tell them what happened about 2 or 3 weeks into it.
About 2 or 3 weeks into it, I was at work and I was really uncomfortable, but I couldn't figure out what was making me so comfortable, and I kept moving. And when I got home, I kind of isolate, and I wasn't doing 100 things at one time.
Yeah.
And what I realized is I was having lower back pain, but it had been almost 14 years since I had felt anything down there. I couldn't figure out, my brain had almost, I think, had forgotten, because I couldn't figure it was strange to me.
Most of us would say, oh, back pain, you were going, where is that coming from? What's making me...
And so I, you know, after I kind of isolated, figure out where it was, I had somebody kind of massage it, and sure enough, that's exactly what it was. But it had been so long since I had felt anything that far down. I mean, I have sensation, but my actual muscles, like, I haven't felt them in that long.
Does that have to do with blood flow, Dr. Cress, that you opened up something to get blood flow?
Blood and nerve supply. And what happens is the brainstem, which is this upper cervical area, if there's a problem there, then it's going to affect the entire spine. So as we said, the brain tells the body what to do. If you cut off the head, we all agree you're not going to survive. You're not going to heal.
Most of the time.
Most of the time. However, you don't have to cut the head off to cause a problem. You can be checking emails, on the phone, poor posture, in a chair.
Cutting off blood flow.
Car accidents. Right, cutting off nerve and blood supply. And as you were saying, look here on the spine, these 2 red lines, these are the blood supply to the brain area. So if we cut that off...
Just by bending wrong or bone...
Checking emails, checking your phone, driving, texting, basically everything we do, we're bending forward.
We weren't really made to do that.
No.
Early man, we were more like...
Hunter-gatherers, you worked it out. But what do? We're in a cubicle in our chair, and that pressure builds up over time.
All right, Lynn, you were in a number of car accidents.
Yes, ma'am.
And so in many of those cases, it kind of just compounded your injuries.
I started my crashing career about 15 years old, and I've been in 11 car wrecks and 2 motorcycle wrecks.
Wow.
I was hit by an 18-wheeler in '02, but I've had pain, but about 3 years ago, I was lifting and for some odd reason just blew out my back.
Yeah, so then the pain became unbearable.
Yes, ma'am.
And what was the treatment for you before?
Pain meds. Pain meds and epidural injections.
Which that can be dangerous, the pain meds.
Well, it gives you a false sense of security that everything's fine.
Yeah.
So you're feeding the beast, you're taking the pain meds, you get injections, you go continue working, and it just progressively made my back worse.
Yeah, and Dr. Williams, of course, the thing that can happen there is that you're causing injury not knowing it because you're not feeling it.
Right, just like if you have a sprained ankle and you're taking painkillers, you re-injure it. And when Lynn came in, he was told he had to have surgery and hadn't been able to sleep a full night's sleep for what, almost 3 years?
Correct.
And his aunt also was made, both their aunts sent them in, said that he would get up like an old man, wasn't able to play with his daughters.
Correct.
And after the first week of care, how were you feeling that first weekend?
It was amazing. It really was. You know, there's a big misconception out there about chiropractors, but Dr. Kress is the real deal, Holyfield. I'm a firm believer. I stopped taking the meds. I detoxed so quick.
Wow.
Yeah, tell them about these meds. These are more addictive than heroin, Lorcet and Soma.
There's a fine line between dependency and addiction, and there's plenty of time just because you get so depressed and it just numbs you to, not just physically, but mentally.
Yeah, people have to be very careful when taking the pain medication. But as we said earlier, what's the best method to simply, and there are people who need pain medication, don't get me wrong. There are people that have to manage their pain because there is no other answer. But Dr. Williams is saying sometimes you got to give things a chance. Like he just said, there's a big misconception out there about chiropractors, and there's different type of chiropractic medicine. What would you say is your area of chiropractic medicine?
Well, first of all, it's our understanding of what health is. We believe that the God-given innate healing potential that we have from God comes from the brain down through the spine. And as we said,
the body was made to help heal itself.
Exactly,
in many cases.
And it does heal itself. You cut your finger, you put a Band-Aid on it, the Band-Aid didn't heal you, you heal it.
Right.
So we simply promote that, and we have 7 different procedures that we use, and I think, I'm not sure if any other doctors do that here in the area, to allow the body to respond. So people, if you're in a chair, if you've been told you need to have surgery, we're doing a whole outreach for Medicare patients because they really respond well. We have people in their 70s and 80s that their diabetes, their blood pressure, they're getting off walkers. You would think they're not going to respond, and they do very well.
Yeah, and you just hit on something very important, as we talked about earlier, how it's, you know, healthcare, the cost stops a lot of people from accessing that healthcare. So there is some help for people.
Right. So we have an affiliate we work with, Medicare, where patients can come in. They can not only get care at our office, but actually they can get home care. That includes a nursing visit, physical therapist, occupational therapist coming to their home. So we actually take care of them in the office and at home. And if they want more information about that service, they can call the office, and we'd be glad to tell them about that.
All right. And to find out more about Dr. Williams and all the services at New Life Source Chiropractic, visit their website, newlifesourcechiropractic.com, or call the office at 713-621-2600, 713-621-2600. And New Life Source has a special offer. New patients who call before Friday, October 8th, and mention they saw this on Great Day will receive 3 visits for just $40. That's a $250 value. So new patients, call now. And I'm going to clarify something. Your name is Kress Williams. Some people call you Dr. Kress. Some people call you Dr. Williams.
It all works.
It all works. All right. Thank you all very much.
Thank you.